Hello, and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each Wednesday at noon for this update. This forum is number 67, and it's being brought to you live by PAC TV on Comcast, channels 13 and 15, and Verizon, channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Kenneth Tavares, Dr. Philip Trafletti, Dr. Barry Potfin, District Attorney Timothy Cruz, Carolyn Raines, Pearl Sears, our town clerk, Michael Jackman, Heather Cozby, and Matt Muratore, our state representative. And each day we begin with an opening message from the chair of the Plymouth Select Board, Ken Tavares. Welcome, Ken.
Thank you, Mr. Moderator. Good afternoon to everyone. I just want to touch on one brief subject this morning, and that is social media. Over the weekend, there was quite a bit of activity going back and forth, and I want to policy regarding social media. We need to be very careful with what we're saying and how we're treating one another. I know patience is short these days, and justifiably so, but some of the things that are being said are extremely hurtful and could be done. The same message could be delivered in a way that would make sense. And don't mean to sound like I'm lecturing on the subject, but impacting the lives of a number of people, and it's okay to have a difference of opinions, which we all do, but it's how we're presenting those differences that. Back to you, Steve.
Thank you, and that's Kenneth Tavares. He's chair of the Plymouth Select Board, and we're now going to move to Dr. Barry Potfin. Barry is a professor emeritus from Yeshiva University, the Department of Biology. He is also the chair of the Plymouth Board of Health. Welcome, Barry.
Yes, thanks, Steve. A few things I need to cover today. One is that obviously we've just entered the fall and winter season. That is accompanied with a lot of concerns, as you probably have read for quite some time. Among the things we're worried about nowadays is the 14-day average of positive tests that we're seeing in Massachusetts. As you probably all well know, that number was below 1% for the past 34 days, generally around 0.8 or 0.9. Now it has got to 1%, and it seems to be slowly edging up. And it's now been stated also that the number is probably actually higher if you exclude all the thousands of repeated negative biweekly tests that are going on for college students. And I've seen one estimate that the daily estimate should be more like 3.4%, which is the most since last August. So in a month, it's gone up quite a bit. Hospitalizations have gone up. It's now at statewide at about 423. This is also the most since middle of August. ICU numbers are going up. And so this is all very, very concerning to all of us that are trying to keep some measure of control over the pandemic that's going on. This whole thing actually includes a lot of tests, and they've actually come out to be the most positive tests over one day since last May. And that's even more worrying. And it's been over 500 if you've looked at the data for the last 2 days in a row. So what's going on? Well, in Plymouth over the last 7 days, there has been 22 new positive cases of COVID-19. And we now have approximately 703 positive cases since this started and 76 deaths. Yesterday, if you look at it, the numbers, again, there was, I believe, 7 new cases, one in their 20s, three in their 30s, one in their 40s, one in their 60s, and one in their 70s. The day before, there were two new cases, both in their 20s. So what we're seeing now is an awful lot of new cases that are at least 20% in their 20s and another 20 to 30% in their 30s. So it's a problem among younger people, which wasn't the case when this all first started. Why is this happening? This is probably happening because of parties and gatherings that are occurring with a lot of people who aren't wearing masks and not keeping physical distance. And it's a big issue simply because when these younger people become infected, even if they're asymptomatic, it's known that within about 9 days after they become infected, this usually spreads to other more cautious age groups. And then within 15 days, it can start to spread to people that are in their 60s and older. So we're having some really serious problems going on with this. I would like to add that at the schools, things are much better. They're being closely monitored. There's a lot of frequent discussions going on between Carolyn Raines and Chris Campbell and the Board of Health and the Department of Public Health. And this is being kept under pretty good control. The students are all cooperating really, really well in terms of wearing masks and being cautious and following instructions. A lot of it is going to depend upon how much cooperation and vigilance we can get from the parents. It's vital, obviously, that if anybody in the household has any sort of symptoms that might be related to the coronavirus, or the students themselves develop symptoms, that they not be sent to school and the nursing staff at the schools be notified as quickly as possible. So if I were to say what's one of the best places to be if you're a young child in terms of safety, it is probably in the schools. I think our school systems are doing an incredible job, and I'm hoping that they'll continue to do so, and we'll do everything we can to help them. The last thing I wanted to mention is some concerns, first of all, about the fact that many people seem to not know that there was a third revised order regulating gatherings throughout the Commonwealth. It came out on August 11th. It's short, so I'll just read it to you. For gatherings of more than 10 people, all persons over the age of 2 must wear a face covering when they attend indoor or outdoor gatherings where participants other than those in the same household will be in attendance, unless they're prevented from wearing a face covering by medical or disabling conditions. This restriction applies to gatherings in all venues and locations, including private homes, backyards, parks, athletic fields, and parking lots. So although the gathering limits are still 25 for indoor and 50 for outdoor, they still also have to abide by this other ruling, which came out involving any groups of more than 10 people. This is also enforceable, according to the state, with civil fines of up to $500 per violation. So it's considered an extremely important thing to be following very, very carefully. Finally, I wanted to mention something about Halloween. Well, there's been some publicity about Halloween. It's upcoming in about a month. And some people feel that things like trick-or-treating door to door could be high risks. They've done some polls, and 50% of the people who answered these polls thought that trick-or-treating door to door should not occur. Another 30% thought that they should be allowed. And another 20% thought they should be allowed, but only in communities that have low risk. Well, so far, Springfield is the only place in Massachusetts that is attempting to actually ban door-to-door trick-or-treating. It is extremely hard to enforce, if not impossible. I guess they're hoping that it'll discourage it somewhat. The CDC came out with Halloween guidelines, and the things you should know is, especially for those who are going door-to-door trick-or-treating, Halloween masks do not provide protection either for the wearer or anybody you come in contact with. It's not recommended to put other kinds of masks underneath the Halloween masks because that can cause difficulties with breathing. So that's a couple of things to keep in mind. According to the CDC, higher risk activities include participating in traditional trick-or-treating where treats are handed to children who go to door, having trunk or treat where treats are being handed out from trunks of cars lined up in large parking lots, and attending crowded costume parties indoors. So please be careful with this. There are a whole bunch of lower risk activities and moderate risk activities that are recommended by the CDC instead of door-to-door trick-or-treating. It'd be much safer for everyone involved, and especially the children. Children, I should also make mention, a lot of people wonder why children are not getting as sick as older people when they are exposed to and infected by this virus. It has to do with how the immune systems function. I don't want to go into a lot of details about it, but there's two kinds of immune system responses to infections. One is called the innate system, which involves some molecules that are routinely present but decrease as you get older, but they're present in large quantities among younger people. They respond immediately within hours of infection. The other one is called adaptive immunity. This is the one where antibodies are created. And this one is not really functioning well in younger people. It is the one we all depend upon as you get older. But unfortunately, it can take days or sometimes up to a week for this kind of immunity to take hold and to actually start to battle the infections. So this is why it seems to be younger people have this rapid response, whereas older people really have a response which is somewhat delayed. And as the virus replicates, obviously it is much more susceptible to the one that is responding rapidly as opposed to the one that responds much more slowly. So that's all I have today. I should mention that places that seem to be subject of complaints for gatherings include the skate park, where our Director of Public Health has been distributing cautionary notes, which are just deemed as courtesies. Some of the other parks, recreation areas. And there was one complaint that came in about Saturday afternoons from 12 to 2 down near Plymouth Rock and Coles Hill, where one side has Trump supporters and the other side has anti-Trump people that have Black Lives Matter signs screaming and yelling at each other. One side wearing masks and the other side not. You can guess which is which. And the last time this happened, one person from the group that didn't wear masks actually crossed the street, went up in the midst of the group of people that were all wearing masks and started screaming at a teenager. This is clearly horrible behavior, and it really has to be controlled and stopped in some fashion. These people are actually putting other people that are wearing masks at extreme risk by engaging in that kind of extremely abusive, controversial, and really nasty behavior between each other. So I'm hoping that the select board, the town manager, and possibly the police can at least look into this and try to keep those groups separated. So those are my pleas and concerns for the moment. I'll be happy to answer any questions anybody has later on in the show. Thank you, Steve.
Thank you, Dr. Barry Potfin. He is the chair of the Plymouth Board of Health. We thank Dr. Potvin for participating on a regular basis, and also for all the members of the Board of Health who have been working tirelessly during this pandemic.
Steve, we can hear you.
And I'm being told I can't be heard. Are you hearing me now?
But I think you said you want to go to Carolyn Raines now, right?
Actually, no. I think what we're going to do
Carolyn, why don't you, Carolyn, you are the Director of Healthcare for the Plymouth Public Schools, is that correct?
I am. Hi, Matt. How are you?
Good. Why don't you take it away?
Good.
Sure. Thanks. So my name is Carolyn Raines, and I am the Director of School Health Services for the Plymouth Public Schools. And I'm in my 5th year here in the district. Certainly one of the most challenging years I think that we've had thus far during my tenure here. And just want to talk a little bit about some of the work that we're doing in the schools right now to support the health and safety of our students and our staff. I think one of the bigger pieces that we worked on early on was working very closely with the Department of Public Health and Department of Education to get their guidance around, what the expectations were in terms of our classrooms in all settings, really. And one of the bigger pieces as well was educating our staff and our students in terms of COVID-19 in general, the virus, and looking at what are the strategies, primary prevention strategies that we can use in the district to maintain health and safety. One of the more recent activities that the school nurses actually were involved in was putting together 3 educational videos for our families and our students, and which we will also share with staff. One of those has been completed. We talked a little bit about symptom monitoring at home for students and staff before they came into school every day, which is one of the bigger pieces, making sure that people aren't, as in the old days, sucking it up and coming into work or coming into school and they don't feel well. We are actually, as a part of that, we are going to be rolling out a new app for our staff specifically to start to look at their symptom monitoring at home. They will log on every morning, answer a series of questions, and the app will basically tell them whether they're fit and able and healthy enough to come to school and direct them in that way. So that's one of the things that we'll be doing with our staff members. Again, I think a lot of this is about self-accountability for our families and for our teachers and staff that come into the buildings every day. We also talked in that video about facial face coverings, what was acceptable, what the expectations were around that, how to properly put face masks on, take them off. Talked a little bit about the mask break piece. We've actually had really great success with all of our students, even some of our very young students. We haven't really had any issues around that particular issue. Certainly stressing the importance, the single importance of hand washing every day. We did provide families some information around hand sanitizer. Since the alcohol content of our hand sanitizer has gone up, we needed to basically let parents know that this would be supervised activity with the children, and that they certainly had an opportunity to opt out if they wanted their child just to perform hand washing during the day, during certain activities and times of day when the kids would clean their hands. And then last but not least, we talk a little bit about like the word physical distancing as opposed to social distancing. We really want to encourage the kids that it's still very important to be social with each other, but to maintain physical distancing of 6 feet. So that we're really hoping that using all those mitigation strategies that we will be certainly contributing to keeping our entire school community healthy and safe. The second video, and something that we've done a lot of education with our staff around, is to, obviously if you're sick at home, what to do, that's sort of a no-brainer. And then what is going to happen during the school day if somebody gets sick, because certainly, illness can come on very suddenly during the school day. And we talked a little bit about what will happen in terms of communicating this to the nurse, the staff or student coming down to the health office. The physical assessment, that again, all of this takes place and has taken place in schools every day for years, which is why we're really, really fortunate in Plymouth to have at least one school nurse in every single one of our schools and programs every day. So that, again, this does support the health and safety of kids. And so there have been children who have come down to the nurse and obviously and staff and who've been able to go back to class, others that have been dismissed. One of the new procedures that we have put in place around dismissal is to provide dismissal instructions to family members in terms of what would like the follow-up and plan of care to be moving forward. And that is pretty much significantly contacting the primary care physician, looking at the possibility or need for an alternative diagnosis and testing, COVID testing for everybody who's been sent home ill. And just looking at that piece, and take one of the bigger processes is the kids now are escorted out to the family vehicle, where we just we try to minimize numbers of individuals coming into the schools every day during the school day. That's sort of a protection on that. And so this also provides our school nurses to have some great communication face-to-face with family members, do some education, having some further assessment questions. So that has worked out really well. And we have one of the things that the school nurses here in Plymouth have done over the course of at least my tenure here and beyond, is having a great rapport and communication with all of our pediatric providers in town. It's really important that we share expectations of each other. We're caring for the same student population. And just making sure we're on the same page in terms of what our expectations are in terms of kids with testing, absences, and just a number and variety of other issues and health concerns, because we do have a number of kids in our district who do have, major medical issues going on as well. So they're truly one of our best community partners that we've worked with. We were also fortunate this year to bring on the services of an interim school physician, and her name is Dr. Roshan Bushmand. She comes from Cape Cod Pediatrics. She has an extensive background in terms of dealing with schools and is very familiar with community health models of care, and has been a great resource for us thus far, is available all the time in terms for questioning, sort of reviewing best practice for us, evidence-based practice, because one of the things that we do feel is really critically important overall is to look at the science with all of our decision making. And there are cases where our nurses and myself, we have a direct line to the epidemiology staff at the Department of Public Health. Some days we're on the phone with them several times, sometimes maybe not at all, but they're a great resource if we feel like we have a gray situation that we're not specifically sure how we need to move forward with, in terms of other family members of maybe a sick student or staff. So they've been really helpful, and they're a great source of support. We have worked really closely with the school health unit at DPH for a number of years. We do get a grant from them. So we have a well-established, relationship, as well as with a lot of the school districts across Southeastern Mass that we meet with regularly. Nurses troubleshoot, talk about different case scenarios. So I think that's also a good support for our health services team as well. And then looking, of course, last but not least, certainly looking at our Board of Health. We've had some great conversations since our schools needed to close back in March. We've taken part in some meetings. We've had some great conversations with Barry. Barry, we have known, he has attended our wellness committee meetings over the last few years here in the district, which has been great. He's done some education at one of our elementary and one of our high schools around vaping and Lyme disease or tick-borne illness. So he's been a great support. So it's, certainly has been helpful that we've already had a good close working relationship with him. And certainly, it always is great to be able to bounce questions and situations off of each other. And then, of course, Karen Keene, our Director of Public Health. I met Karen back in March when we were looking at the MAVEN network and looking at, just in terms of being familiar with that, in terms of it being a network where reportable diseases are conveyed by state labs to the state and to primary care physicians. I have never been a public health nurse, but there have been a lot of school nurses actually across Massachusetts that have over the summer worked closely with their local boards of health and public health directors, working, actually in the MAVEN system, working on contact tracings. So that is something that we are also sharing in our second video when we're talking to families, just to try to educate them a little bit on the contact tracing piece. And if we were to have a positive student in the district, which, being transparent, we want to be, totally open and transparent with families. We have had 4 cases thus far this school year, and letters have gone home to the families, letting them know, and just trying to stress with the families that if your child was a close contact, whether it be on the school bus, on the playground and gym, in the classroom, that you would be notified immediately. So just, knowing how we're looking at the contact tracing piece and seeing how important that variable is in terms of mitigating any increased risk to our school community. So I think, I don't know, again, the community partnership is important. We are reporting any positive cases that we have to the Department of Education. Dr. Campbell, our superintendent, has certainly had many conversations with the commissioner at the Department of Education. And if we have concerns or questions, I think looking at the overall, this whole situation certainly reflects the importance of the community at large, and how the school districts are certainly a reflection of that. It's been great for us that our community here on Plymouth has not gone into any other zone, but we're staying low risk. I think that's really important. And I think because of a lot of the prevention strategies we've put in place, I think that has certainly kept us in a lower risk community. And that is really important in terms of our schools, because I think there's a trickle down effect for sure in that respect. So I don't know if again, if anybody has any questions or if I have, left anything out. I just want to say that the administrators here and the district have worked extremely hard to make sure that we have crossed all of our T's and dotted all of our A's. And I think one of the things it's sort of has always been the mantra, even with with Dr. Mayas's tenure here too, is that the health and safety of kids are our utmost priority. And of course, we include school staff in that as well. And we know that the link between health and learning is critical. And so, if you don't have a healthy child, you're not going to have anybody learning. So again, we have had a lot of distractions in terms of the education piece with all of the changes we've put into the schools. And hopefully, the kids are very adaptable. And having an opportunity to walk through the schools every day, even with the little ones in the elementary schools, kids things have fallen into place for them, and everybody's really just doing the best job that we can every day to keep everybody in Plymouth, safe. So again, if anybody has any questions at some point today, I'm happy to answer them for them.
Thank you. And that's Carolyn Raines, and she's the Plymouth Public School District Nurse Leader.
Okay, thanks very much, Carolyn. Appreciate that. I think,
Sure.
Yeah, are you there, Steve?
Yes, and she'll be here to answer your
No, we still
questions
can't hear Steve.
to PlymouthInfo@pactv.org.
All right, why don't we go to Dr. Triffletti?
So clear, Matt can't hear you.
Matt, I don't know if you can hear me. I'm going to continue. And at this time, we're going to go to Tim Cruz. Tim is the Plymouth County District Attorney. And Tim, this morning, I was actually in Wareham District Court with one of your assistant district attorneys at a Zoom hearing with the judge, with the clerk magistrate, my client, his wife, and an attorney. So give us an update since the last
Thanks for
time
having me,
you appeared before us.
everybody. It's nice to be back. Things certainly have been, like with everybody, different and unusual for the last few months, and unfortunately, it appears that they're going to continue to be so for a while. But notwithstanding all of that, we continue to do our work here virtually in the community and continue to still talk to people in various groups of educators and people in our community who are dealing with the problems that we have. So in the last few weeks alone, I've spoken to the Department of Mental Health forensic psychologists about our drug endangered kids programs that we've been had ongoing here for quite a while. We spoke about resiliency with educators from the Plymouth Youth Development Collaborative. We've met with Carver officials to talk about the Trauma and Learning Policy Initiative that we've had with Harvard and we've had with other cities and towns here in Plymouth County. We participated virtually in Father's Day Peace Walks and International Overdose Days. And we continue to take many PSAs regarding the issues that are ongoing, because even though there's a pandemic, there are still issues that we have to deal with and that we all have to deal with. And we also developed a cable show called Senior Safety, whereby we go on, we talk about a lot of the issues that our seniors are facing, including a lot of the scams and the things that we're dealing with. So whether it be COVID-19 issues that are going on for scams, or whether it's being with contact tracing, trying to just continue to keep people aware as to what's going on. Because even though the courts have been closed for really the last few months, we need to continue to work with everyone, continue with our trainings, and so that when the curtain goes up again, so to speak, we're going to be up and ready to go. And although the courthouses are once again open here in our county, virtually all of our courts are going to try to continue to do things virtually, whether it be by phone, whether it be by video conference, an email. If you come to the courts here in Brockton or anywhere in our county, be prepared. You're going to be screened beforehand you go in. They're going to take your temperature. They're going to ask you questions about travel or any exposure that you may have had to people who are positive with COVID-19. Trying to, once again, what they're really trying to do is limit the number of people who are in the courthouses to minimize the potential exposure that could happen with that. And that, I think they're doing a good job with that. But the sometimes it just seems like the goalposts keep getting moved down the field, and the rules keep changing. So we try to adapt with that as best as we can. They try to limit people who can just go into the courthouse to the extent that they can. So for now, personnel obviously can go in. People who need to be there for the in-court proceedings would certainly be allowed to go in. People with business with the clerk's office or the registrar's office, recorder's office, meetings with probation officers, and jurors. Although, quite honestly, we haven't had a jury trial since March. And as to when the next one will be, it's unclear. I know that they've given us a date of October 23rd. I think that is hopeful. If you do get a jury notice, I would suggest that you call the numbers on there to see whether or not it's going to be viable, because usually you'll get it a few months in advance, and they'll give you a heads up as to whether you should go to that court or not. Getting in touch with the jury commissioner, I think they may have a better idea, but from what I've seen and seeing the dates continuing to be moved, I'd be shocked if October 23rd we're going to be up and running. That's just 3 short weeks. And I know the challenges that we're having, quite honestly, dealing with juries and trying to get people into the building, because we have to also socially distance the jurors. We have to have a bigger area than what we normally did. And I think it's going to change the rules and regulations regarding, trying either civil cases or criminal cases with 12-person juries or 6-person juries, and the cases that have to be mandated to have this certain numbers there. So I think that we're going to continue to see issues with that for the next few weeks. We've been hopeful to get, we've gotten our approval from our regional administrative justice here at Superior Court to get again our grand jury. A grand jury is a jury that meets twice a week for 3 months and listens to the more serious cases and see whether or not those cases should be indicted and go to Superior Court. That's an essential tool for us to have, and it's a necessary step for the serious cases, homicides, serious sexual assaults, drug trafficking, things like that, to go to the next step. So it's very important for us to have that. We're hopefully going to be starting again this Friday as pertains to impaneling that grand jury. So I'm glad that that's happening. Then we have another phase coming at us here in February 21. The SJC and the Jury Management Advisory Committee will evaluate phase 1 and see if we're ready to go to next 2. But like I said at the outset, notwithstanding all these rules and regulations at the courthouse, the job continues. And the state police assigned to my office, working in conjunction with the local police officers, continue to make significant arrests of individuals who are dealing with drug trafficking operations and people who are out there creating havoc in our community. And I think that, as we still continue to try to get that poison off our streets, fentanyl, carfentanil, it's a real issue out there, and trying to make sure we get the people who are trafficking in those drugs, they're not users. They're the people who are they're using people to make money on the backs of people who are really being terrorized by these terrible drugs and these terrible diseases. We need to make sure that those people are going to be in a position where they're going to be held accountable for their actions. Our overdose numbers, I think it's a fair statement to say that as I sit here right now, they're relatively stable. I think actually they're down a little bit. As I look at, we keep track of all the unattended deaths that occur in our county here, which means this is just the numbers of individuals that pass away due to fatal opiate overdoses, not inside a hospital setting or perhaps a nursing home or something along those lines. But in the town of Plymouth, in 2019, we had 22 fatal opiate overdoses, not counting hospital settings. As we got through September this year, we've had 11 so far. So we're at 11, and that's the number which I'm showing is it's showing a trend. I believe it's going down, but still one fatal overdose is too many. We're really lucky here to have our task force and to have Plymouth County Outreach, which is really, formed out of the task force with Chief Muratore and Chief Allen, the former chief from East Bridgewater. They did a tremendous job getting all of our chiefs on board and making sure that we can get resources and get recovery coaches and bring help to people that need it the most. And I'm very happy with that, that we've been able to continue to do that. But we continue to participate virtually in the Plymouth County Outreach quarterly monthly meeting. We're talking once again about overdoses, Narcan distribution, on-call recovery coaches, going door to door, and they're going by phone also because of the challenging times that we face. We just received here in Plymouth County a human trafficking grant, which was really exciting to get that grant. I know we've been working hard to get it from the U.S. Department of Justice. That means really our office with Health and Trauma Services Agency, Health Imperatives, we both applied for it together and approved for $1.5 million in funding to bolster efforts to investigate and prosecute human trafficking cases and get the victims, just as importantly, the vital services that they so desperately need. So the DA's Office of Health Imperatives were the only grant recipients in Massachusetts of the 30 awarded agencies and programs from 11 states that applied for it. Human trafficking, if you may not be aware of it, it's not just something we see on TV. It's something that's here. It's something that we need to deal with also. And it's really one of the fastest growing criminal enterprises in the United States. And it's pervasive here in Massachusetts. And it really doesn't have boundaries. It can go from our county to adjoining counties or throughout the state. So while we've got a human trafficking legislation which has gone into effect, and I think that's great. But we still have communities who are dealing with lack of resources, and as well as lack of training as pertains to the investigations, prosecutions, and victim services. I think that trainings have indicated to me that we're sorely remiss in that, and I'm glad that this is going to be able to help us do that. We're going to continue to aggressively pursue those individuals who manipulate or abuse or sell human beings for profit. And we're going to work just as hard as we do with our Children's Advocacy Center and trying to help our kids here in our county who are getting physically and or sexually abused. And and last year we had more than 1,200 kids in our county in that situation going through our Children's Advocacy Center, trying to get them the services. It's all about really trying to stop these cycles of domestic violence or cycles of human trafficking and child abuse, and trying to stop it by providing the services while at the same time prosecuting the people who are hurting our children. I think it's really important to do that. So we'll continue to do that and making sure that we can keep people as safe as possible. So our work here continues. It's just kind of a little bit different. And crime's not going to stop happening during a pandemic. And every day we're going to continue to fight for the victims of the crimes that occur in our county, and making sure that they're heard and making sure that they have voices. So we will continue on today as we always do. I thank you all for giving me the opportunity to speak a little bit about what's going on here in our county, and I hope everybody stays safe and stays healthy.
Thank you. That is Timothy Cruz. He is the Plymouth County District Attorney. He's available with our panel to answer your questions. Email us at plymouthinfo@pactv.org. And next we're going to be going to our town clerk. That is Pearl Sears. Pearl, welcome back. I think the last time you were with us, you were the assistant town clerk. So congratulations and thank you for joining us.
Thank you. And thank you for inviting me. Yes, I've been the town clerk for a little over a month now. Haven't gotten bored yet. Wanted to talk today a little bit about the elections. A lot of people have been calling and emailing to find out why they don't have their ballot yet. We have not received them. We don't expect to receive them until the earliest will be Monday, the latest will be next Friday. So by the 9th, we're going to get those. Keep in mind that we also have a 3-day weekend that weekend. So the post office will be closed on Sunday and Monday. And we're going to get those out as fast as we can. If you haven't registered to vote yet, the deadline is October 24th. You can do that online at the RMV, or you can do it in person here. We are going to be having early voting. That'll be starting on October 17th and running through October 30th, and will be available here at Town Hall. One of the things I wanted to go over was the new elections website. They've got a lot of great features that they've been adding. One is the availability to register to vote. One is the ability to track your ballot. So once your ballot's mailed out, you can go on to this website, put in your name and address, and that's going to tell you if your ballot has been mailed. So you don't need to call us. You can go look it up on the website. Once you receive it and you mail it back to us, it'll tell you if your ballot has been received back. So you know that the mail got the ballot to us, which is nice. If you have not applied for a ballot yet or applied for a different address, some people may have thought they were going to be at school or at their second home. If you need to change your address to mail your ballot to, you can apply for a new ballot application on the state website, and that will change your ballot request to make sure we get it to the right address. We're going to get those out as quickly as we can. We have almost 16,900 ballot requests at this time, which is more than our last one, which was our record. We're going to be having an advanced processing center. By this I mean we're going to take the ballots that come in through in-person early voting and through the mail, and we're going to put them through tabulators. We're not going to calculate the results until election night, but there's just simply going to be too many ballots to bring them to the polls and get them done in one day. So we will be processing ballots. That'll start on October 25th. It's going to be done at the library. Observers will be welcome. We're going to post the dates, times, and policies for that because it will be a limited number of people. We're going to ask that everybody get their ballots back as quickly as you can to make sure that we can get them counted by Election Day. And if anybody has any questions, I'd be happy to answer them. Thank you.
Thank you. And that's Pearl Sears. She's the Plymouth Town Clerk. She'll be here to answer your questions. We're now going to go to Dr. Philip Trafletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil. And today I think we're having trouble with his bandwidth, so we're going to come back to him. Today we're having some Zoom challenges with both the audio and the video. So we're going to hold on Dr. Triffletti, and we'll come back. We're going to go to Michael Jackman. He's the district director for Massachusetts Congressman William Keating. Hi, Mike.
Yes. So,
Yes, thank you, Steve, and thank you to PAC TV, as always, for hosting this regular update. It's so important to hear from all the different entities and organizations in town about what's going on with the COVID-19, and I always learn something from all the great speakers you have. Welcome to the new clerk. We haven't met yet, but I don't envy you the next couple of weeks, but I'm sure it'll be an exciting initiation to you as you begin your clerkship. And kudos to the DA Cruz for winning that grant. It's a very great sign and a great honor to receive that. And it's such an important topic that doesn't always get the coverage that it deserves, preventing human trafficking and so much suffering that can be prevented through your work. We commend you for that. Just a few things I wanted to mention, just to echo what the DA mentioned as well. Our offices, Congressman Keating's offices, are closed to the public, but we are working, as you can probably tell. I'm at home today, but we are available in our offices on an as-needed basis. We have had a few folks who have had trouble with either unemployment or getting the stimulus payment and needed to provide physical copies of documents to the state or to the IRS, and we've been able to receive those and pass those on to our liaisons at the different agencies. So, as always, please give us a call if you do need that type of in-person service. The number in Plymouth is 508-746-9000. Speaking about the economic impact payments, more commonly known as the stimulus payment, I've talked before about the HEROES Act, which the House passed back in May, but the Senate chose not to take up for a vote. Well, we're hearing now that there's an updated HEROES Act, which is not quite as, the bill's a little bit lower in terms of the amount of funding, but seems to be a little bit more amenable to both sides of the aisle. And we're hoping that there'll be some action on that in the next weeks. It will include another economic impact payment of $1,200, $2,400, up to $1,200, up to $2,400 for a couple. Also would reinstate the $600 per week enhanced unemployment benefit that was ended in July, that was provided by the CARES Act originally. There'll be some relief for local governments, state government and local governments, which have seen such tax collection shortfalls over the last 6 to 7 months. And another paycheck protection program would be included as well, as well as housing, emergency assistance for low-income renters who are at risk of eviction due to the COVID-19 pandemic. As we know, the state is in the middle of a moratorium on evictions that expires this month. There's also a federal moratorium that is related to renters who have federally backed vouchers. So this would extend beyond that and hopefully help some folks who are renting who are having trouble paying, would have trouble when that those moratoriums are expired. One thing I do want to say is we still have quite a few constituents who have not received the first economic impact payment for various reasons. The IRS is now telling us that folks who qualified for a economic impact payment but did not receive it will have the ability to claim what they're calling a recovery rebate credit when they file their 2020 taxes next year. So we will be looking out, and I'm sure Heather will also be looking out for that information from the IRS on how you can claim that credit when you do your taxes next year. So hopefully we'll have some good news on this updated HEROES Act over the next weeks. Certainly the people still need the assistance. There's no doubt about that as we slowly are emerging from the pandemic, but unfortunately there's still a lot of suffering out there and people who have been impacted financially. And we want to make sure that those folks can feed their families and keep their roofs over their head. The other thing I wanted to mention is the CARES Act. A lot of the funding in the CARES Act was set to expire at the end of this year. December 30th, I think, is the date. And the House is looking at it, specifically our office is looking at possibly amending that. And that might be part of this updated HEROES Act. I'm trying to get information on that. But as I said, the pandemic is not ending, and schools are back in session. A lot of the funding that could go to schools so that they can keep students safe, they can make sure they have all the physical barriers in place that will allow learning to happen in the classrooms and allow kids to travel throughout the school safely. A lot of those physical barriers are can be reimbursed through CARES funding, but of course the school year goes until next year, next spring, in early summer. So if that funding runs out December 30th and has to be returned to the federal government, it's not going to do our school systems or our towns any good. So we are looking at trying to extend that deadline through legislative action. Again, I hope to have more to report on that over the next couple weeks. Last thing I just want to mention quickly, kind of related to what Carolyn was talking about. The Health and Human Services federal agency has released what they're calling this Abbott Labs rapid test. I guess it's called a Binax now. It's a 15-minute test. It's a little more reliable from what they're saying than other rapid tests that have been released. The administration is sending out 150 million tests throughout all 50 states, and the goal is for the states to use the tests to keep kids in school and be able to learn in person. And the governor mentioned yesterday at his press conference that they'll be, the state will be announcing soon how those tests will be distributed, and clearly there'll need to be some training on how to do the tests. I think if you saw the demonstration by the testing czar, Brett Gerard, I'm not sure how to say his name, but he did a demonstration during his press conference and made it look pretty easy. So hopefully that'll be something that'll schools and towns will be able to use to keep kids safe and keep staff safe as well. So that's about all I have to report. And again, thank you for the opportunity to be with you here today.
Thank you. And that's Michael Jackman. He's District Director for Massachusetts Congressman William Keating. At this point, on behalf of PAC TV, I'd like to apologize for the audio and the video issues that have arisen today with the Zoom feed. So at this time, we're going to conclude our presentation, and next week we're going to bring back a few of the guests who could not join us today. Again, apologizing to Heather Cozby, our Plymouth CPA State Representative Matthew Muratore, and Dr. Philip Trafletti, who will be joining us all next week. On behalf of Kenneth Tavares, Matt Muratore, and me as Steve Triffletti, Plymouth Town Moderator, want to thank you all for joining us. Please join us next Wednesday. We hope to have these issues resolved. Good day, and thank you.